Now, a question that a lot of people are curious about is, can menopausal symptoms be improved with lifestyle change?
Yes, they can. Now, menopause is an interesting one. I see so many women suffering with menopausal symptoms. It's very real. It shouldn't be this way. We all know that it's a natural physiological process that at a certain age, around about the age of 50 on average, our periods will stop. But the symptoms associated with that can be absolutely crippling. And, or this is just a general overview talk, so I won't go into detail about things like premature menopause and things like that. But essentially, when this happens, a lot of women get potential symptoms. So hot flushes, or flashes as you call them in America, is one of the main ones that women will notice. It causes absolute dripping sweat at night or during the day, anytime. Insomnia, mood changes, differences in weight distribution. You can feel quite, as I said, quite low with it. It can change your skin. It can change your libido. It can have all sorts of effects. If you think of a body system, it could potentially affect it, because at the end of the day, our bodies are designed to respond to estrogen. Not too much, as I mentioned, a bit like Goldilocks. You don't want too much, but you don't want too little. And what's interesting is that in countries such as Japan, there isn't actually a word for menopause symptoms, hot flushes, for example. And the reason for that, at least that's what I've read, is that they don't tend to suffer from them as much. Like, it's not generally a thing. And that is thought to be because they do have, well, first of all, they don't generally traditionally have much dairy, which can potentially be an estrogenic exposure. But secondly, they all consume minimally processed soy, which has been shown to be potentially beneficial for menopausal symptoms. There was a Japanese study, and what they showed was that the more soy women ate, the less hot flushes they had. I think they reported a relative risk reduction of 68% less likely to have hot flushes if they ate soy products regularly every day. So that would definitely be worth looking at if you're suffering from menopausal symptoms. There are various herbs and supplements as well that have been shown to be anecdotally beneficial. Black cohosh, sage leaf, turmeric, all sorts. So I would say if you're going to try different herbal supplements, it's worth trying to find a reputable source so that you know that you have a consistent concentration and you know where they're from. In the UK, we have traditional herbal registration, which is really handy because then you know that you can trust where those herbs have come from. I don't know if you have a similar system in the US or not, but you can give it a go.
Not that I'm aware of. That sounds like it would be nice.
It would be, yeah, it's quite good. But yes, definitely it can be beneficial. We can talk a little bit about HRT as well if you want, but I think, okay, so with HRT, it's I'm not against HRT, by the way. I think many people would assume that because I talk about the benefits of nutrition for overall health, then I would potentially be against HRT. I'm not. I think it has been a real lifesaver for a lot of women who've been suffering hormonal symptoms of menopause. There is an increased risk of breast cancer with HRT, but when you look at the relative risk, it's actually quite small compared to other things. So if you take HRT for 5 years, your risk of cancer increases by about 1 or 2 in 50. Whereas if you are carrying excess weight, it's more like 20 out of 50 more. If you drink alcohol regularly, then again you're looking at about another 5 to 10 out of 50 more. And so you can see that actually a lot of the other lifestyle related things are more important when it comes to breast cancer risk. And some women really do find that it is life-changing for them for at least a while. The increased risk of breast cancer does gradually become more significant the longer you're on HRT after menopause, so that's something to think about. But you just have to really balance your quality of life and your lifestyle with your medication needs and speak to your doctor about it. HRT stands for hormone replacement therapy. It comes in many different forms and many different names and types. You can have it in a patch. You can have it in gels. You can on the skin. You can have it in gels locally. So, for example, there's certain gel like estrogen gels that you can have for the vaginal area to reduce vaginal dryness and potentially, therefore, also reduce risk of urinary tract infections, for example, which are more common as you get after menopause as well. So, there's lots of different ways that you could potentially use hormone replacement if that's something that's of interest. But what I love about talking about diet and lifestyle is that these are the things that are the most important bases on which to then take further action. Like, you're far more likely to improve your health by cutting back on the alcohol, moving your body regularly, eating whole foods, eating plant foods, and then seeing where you're at.
So let's talk about that a little more. You mentioned minimally processed soy. So what would be some examples of that? And in general, just what are your top hacks for hormone health?
So minimally processed soy is essentially soybeans that have gone through a slight process to make them look a bit different. So things like tempeh is very minimally processed. Tofu is slightly more processed, but still minimally processed. Edamame beans are great. Then you've got miso paste, which is a fermented soy product that you can use in cooking. You can add it into whatever dish you might be making. Soy milk as well. There was a really interesting study about soy milk and hormonal symptoms. They gave women, now let me get this right. There were 3 cohorts of women. One didn't have any intervention. One had a progestogen cream and the other one had soy milk. And they looked at bone mineral density scores. Those that didn't have anything gradually had a reduction in bone mineral density after menopause, which you would expect. Those that had the progestogen gel had a slightly less of a reduction in bone mineral density, which was great. But the women consuming daily soy milk actually had a slight improvement in bone mineral density. So that's something also to consider when you're coming up to the age of menopause, is to think, okay, well, actually, there are lots of reasons to think about using soy, not just for reduced risk of breast cancer, not just for reduced risk of flushing, but also potentially to improve your bone mineral density. So yes, soy is very helpful in that regard. So those are the sources of minimally processed soy, and of course edamame beans, which are great. And other hormonal health hacks, I've touched on them already, but I just really want to hammer it home so you've got real take-home messages for the people on the summit. Whole foods, plant foods in abundance. That increases your fiber intake, which then also reduces your excess estrogen exposures. It's a really great idea to think about exposures to plastics as well. So think about, okay, well, if I'm warming up a meal in the microwave, maybe I put it in a ceramic dish. If I'm drinking a lot of water, it's hot, I'll get myself a bottle that's made of glass or something other than plastic. If I am drinking out of a plastic bottle, then, we can't escape doing that from time to time. Really aim to avoid drinking warmed up water or warmed up whatever you're drinking from that plastic, because there's going to be potentially more microplastics in that than if it hadn't been warmed. Whole foods, plant foods, minimize plastics, sleep. Now, sleep is a real great pillar of hormonal health. It's a real problem as well when you're coming up to menopause, because the hot sweats can lead you to not being able to sleep. We know that having an increased body temperature and sweats reduces our ability to fall asleep. So hopefully if you can control the sweats, then you might be able to sleep a little bit better. Controlling stress. Cortisol hormone is connected to stress. So if we can minimize cortisol exposure, then that also improves our stress levels. That's a great one. And moving our bodies, really, really important hormonal health hack. It's so important. It helps our lymphatic system to flow around the body. It can help to reduce our risk of cancers as we get into our older years. And there's lots of things that it can benefit in terms of our hormones as well. It can improve our insulin sensitivity, which is obviously something that people on this seminar will be really interested in, improving their insulin sensitivity. So yeah, moving your body as well.
Our bodies are designed to move, Dr. Newman. I mean, we're designed to eat well and have the energy to move. So it all makes sense that it would benefit our hormone health as well. So